Hi students, how are you? I hope you are all good and doing well in your studies. Today you are going to learn blood grouping, ABO blood grouping and Rh typing. In this lecture, we are going to discuss forward grouping by tube method. In the next lecture, we will discuss about reverse grouping by tube method. Firstly, let's see the principle of this method. The procedure is based on the principle of agglutination of antigen-positive red cells in the presence of antibody directed towards the antigen. If the person have antigen A, antibody A is directed towards this A antigen, and if there is B antigen, antibody B is directed towards B antigen. When this happens, you will see agglutination, and agglutination means the positive reaction. Now let's see the procedure of forward typing. First, label the tubes with identification and anti-A, anti-B and anti-D. Then prepare 5% cell suspension of patient RBCs and add 1 drop of patient RBCs in these 3 tubes and add 1 drop of anti-A reagent in anti-A tube, anti-B reagent in anti-B tube and anti-D reagent in anti-D tube. Then gently mix and centrifuge for 15 seconds at 1500 RPM. Then examine for agglutination and record the results. If you see agglutination in anti-A tube, it means the patient is A. And if you see agglutination in anti-B tube, it means patient blood group is B. And if you see agglutination in both A and B, it means the patient blood group is AB. And if you don't see agglutination in anti-A and anti-B, it means the patient blood group is O. And if you see agglutination in anti-D, it means the patient is Rh positive. And if you don't see agglutination in anti-D, it means the patient is Rh negative. So now let's see why you see agglutination in anti-A. If you see agglutination in anti-A, it means on the red cells of patient there is antigen A present And when you add anti-A reagent that contain anti-A antibody, this A antibody directed towards A antigen, and you see agglutination. In this scenario, the patient have B antigen on their red cell surface, and when anti-B is added, this anti-B attracted towards or directed towards anti-A antigen, and that's why you see agglutination. In this scenario of AB, the patient have both antigen A and B. And when you add anti-A antibodies, anti-A antibody is directed towards antigen A, and anti-B antibodies directed towards antigen B. That's why you see agglutination in both tubes. And in O blood group, the person don't have any antigen, don't have A or B antigen on their red cell surface, and when you add anti-A and anti-B antibody, these anti-A and anti-B antibody don't direct it towards the antigen, as there is no antigen in the red cell surface. That's why you see no agglutination in O blood group. Notice that A directed towards A, B directed towards B. So that's how it's easy for you to remember. Forward grouping is very easy to interpret, as when you see agglutination in anti-A, it means the patient blood group is A. If you see agglutination in anti-B, it means the patient blood group is B. If you see agglutination in anti-A and anti-B, it means the patient blood group is AB. And if you don't see agglutination in any of this, it means the patient blood group is O. So that's all about ABO and Rh typing. I hope it's helpful for you, and if you want these slides, you can get a link in the description box. Thanks for watching. Please do like, share and subscribe my channel for more updates. Thank you.